All right, Assalamualaikum and a very good afternoon, everyone. Welcome to my session. I think this is my first session after we had it online on a previous one. Okay, before I begin, hold on, open my notepad. Okay. Okay, before I begin, for today's topic, for this 2-hour session, I'm going to cover on the pharmacology of aesthetic medicines, as well as the definition of medicines and cosmetic. But before we begin further, that I know that some of you have been in the service for maybe like 3 years, 5 years, 10 years, and you could see the varieties of the experiences that we have here. Okay, now I'd like to ask, do you know what is the differences between medicines, between cosmetic, between traditional, and between supplements? Do you have any rough idea? I'm going to put in my notepad here. All right. As for all of us, we know that we are truly a Malaysian because we have our own IC. We have our ID number, determine that we are Malaysians. But how about that we know that our car are registered in Malaysia, you know, based on the plate number, you know that you registered to the JPJ. But now let's talk about medicine. How do you know that this medicine is being registered in Malaysia? How do you know that this is the registered nation? This is medicine that registered in Malaysia. How can you notify them? How can you differentiate it? This one is registered or this one is unregistered. How do you know about that? Do you have any idea? Do you know what is the ID of medicines in Malaysia? We know our ID is our IC, our birth certificate. We know that our car based on the plate number. So how about our medicine? Do you know how can we identify them? What are the ID for our medicine? I'm using the notepad so easier for those who are actually online to can see this. If not, I'll be using the whiteboard. Okay, can anyone give me a rough idea? How do you know that this ID belongs to medicines? How do you know that it is being registered in Malaysia? Anyone? Online ada jawapan dekat chat. For those who are here, you just raise up your hand, I can go to you. All right. Okay, so someone in the chat box said mile number. Okay. How about KKM number? Have you heard about this? I think most of the influencers, social media influencers have been putting mile number, KKM number. What else? All right, I already give you a few options there. MAL, KKM, MOH, and also NOT. All right, for those who are online, you can put the answer there and Shikin can help me out to read out the answer. But those who are here, can you just raise up your hand? No worries. Because nowadays, furthermore, we are wearing our face mask, we won't recognize everyone else except the eyes, but for sure, we will forget everyone of us unless you are next to us. So don't worry, nothing to be shy of. So, okay, whoever said that the only way to identify ID in medicine is through mile number, raise up your hand. Mile number. In this hall, who said MAL is the registration ID for medicine in Malaysia? Raise up your hand. Okay. Who said KKM? All right. Who said MOH? Right. Who said NOT? All right. Who said all of them? All above. 1, 2, 3, 4. All the above. Kat dalam tajuk. All right. Okay. So basically at this point, doesn't matter if you don't really know, but after this 2-hour session, I want you guys to have this as at your fingertip. You got to remember this till you retire or you expire. because that this should be the first thing that you know in order for you to actually empower your patients. But on top of that, because we need to talk about aesthetic medicine, we barely know that not everyone know about aesthetic medicine. That's why we need to differentiate this thing clearly. Right, the answer is actually MAL. MAL is the only identification for medicine registered in Malaysia. All right, now I know that all of you are joining aesthetic medicine. So for sure, you have cosmetic in your handbag. Even though we're not using our lipstick so much now because we're wearing face mask, but I think that all of you have any kind of cosmetic in your handbag, right? All right, I want to ask all of you, what is the ID for cosmetic in Malaysia? Have you seen? I think MAL you can see at the boxes, right? While you are in your clinic, in your GPs, in your hospital, for sure you'll see the MAL number is there at the boxes. But have you seen any kind of registration ID for cosmetic before? Have you seen it before? Have you seen it before? All right, now please take out one of the cosmetic that you have in your purse, in your bag. Have a look. I tak boleh nak move orang pergi sana, kamera tak bawa pergi sana kan. Nanti online tak nampak. Same goes to actually online people. Lagi senang dekat rumah kan, you are at home, your office, for sure you have your cosmetic with you. Alright, do you see any ID there? Do you see any ID like MAL like we used to have for our medicines? Do you see there? No. Ada tak? Siapa yang ada, raise up your hand. Ada tak yang dekat online? Do you have it? Your lipstick, your mascara, ada tak? Alright, how about perfume? Is perfume cosmetic or not? How many of you say perfume is cosmetic? Raise up your hand. Okay, siapa yang kata bukan, raise up juga. Siapa yang cakap, I don't know. Okay. Alright, perfume is cosmetic as well. So you have cosmetic in your perfume in your purse, can have a look. Okay, is anyone here see any ID on their cosmetic box? Ada tak? Yang you buka tadi, ada tak? Ada. Apa yang ada, tolong doktor baca kan? What do you say there? Okay, they want a code for your cosmetic, I think. The code belongs to that brand. Right, who else? Do you have anything on your cosmetic? Can you see it? No. Actually, the answer is no. You won't see it because it's only compulsory for medicine to be printed their ID registration on their boxes or pamphlet. But it's not compulsory for cosmetic. Cosmetic kita pakai NOT, stands for notification. Right, that's why I don't put my slides first because I know it's 2 o'clock in the Saturday afternoon, those who are actually online. I want you guys to remember this because if we ourselves as the medical professional don't even really know about this, that's why our patients could easily trusted for those selling online. So this is the first thing that we should know at our fingertips. If there's no MAL there, meaning they are not registered. Okay, another question. Where can we check the authenticity of this MAL registration number? Where is the databases that we can refer to? Do you have any idea? You've been using it? Okay, baca kan? NPRA. Okay, NPRA. Someone from website said. But where is it in NPRA? Later on, I'll explain. But this one, from the one that you actually been referring since your MO's day. You masih lagi HO, MO, you're referring to this kind of your Bible. What is it? Do you have any idea? Kat mana kita boleh tengok dia punya database? Nak check dia punya registration kat mana? Bluebook, okay. Hold on, sorry. Okay. Bluebook, and then tadi ada cakap NPRA. From the hall? Any idea?
The rest of the doctors say
MIM. All right. How about people from here? Do you have any other answer? Quite sikit tak dengar. What is it? Okay, can you guys help me to pass around the mic? Do you have any answer? Do you have any idea? Where can you find the register number? Okay, the answer is actually, you can find it, yeah, true, from your memes, from your Bluebook, as well as the NPRA website. But in the NPRA website, you have to go to the quest 3. So yang ini kena dekat quest. Nanti we're going to have a hands-on session together with those who are actually online. For those who are online, you need to screenshot and show it in the comment box so we know that they're doing it. For those in the hall, you need to do it on your handphone, then I'll go around and see. After this, we're going to do hands-on on it. Okay? All right. All right, now come back to another question. What is the differences between Bluebook and memes? What is the differences between Bluebook and memes? Do you have any idea? You know that memes that you have it in your clinic, you have it during your uni time. What is the difference between Bluebook and memes? Okay, first of all, what is Bluebook? Any ideas from online? What is Bluebook? What is Bluebook? Can you help me to give my...
From Dr. Megesh,
Okay.
memes have more info per brand.
All right, more info per brand for memes. Okay, thank you. All right.
Unofficial Bluebook sourced from pharmaceutical service provider management and official.
Okay. Unofficial, okay. All right. Who else has the answer?
From Dr. Ethan, Bluebook is by KKM, but meme is national, right?
All right, okay. Dr. Ethan, from your online class, from your online colleague saying that Bluebook stands for KKM, and then memes for everyone. Okay, actually, memes contain all drug that is registered in Malaysia. Memes contain all drug that is registered in Malaysia, while Bluebook contains all the drug that is allowed to be used in all MOH facilities. Okay. Right. Another question. How do you know that the drug is registered in Malaysia? You know from MAL. But to whom they are registered to? You know you are Malaysian because you have your birth certificate registered under JPN. You have your IC under JPN. But how about our car? We have our car registered under JPG. They have their own chassis number. So, but how about the drug? Who are the legal body that are taking care of their registration? Who is taking care of their registration? Do you have any idea?
From Dr. Megesh, under NPRA.
Okay, Dr. Magesh and NPRA. Right, again, this NPRA is a very vague answer. Everyone was talking about NPRA, but from which body? You have to be accurate. You see, where are you working at? KKM, MOH. So we know that it's very wide places. Okay. Other than NPRA, do we have any other answer? Yes? Oh no. Do you have any other answer from other than NPRA? Okay, have you heard of this before? Have all of you heard of this before? PBKD. Have you heard of this before? Pihak Berkuasa Kawalan Dadah. Ataupun in English, we call it DCA, Drug Control Authority. Sorry. So they are the one who actually managing the registration of drug in Malaysia. All right, I have another question before we move further. Does unregistered drug allowed to be used in Malaysia? Do we have any certain of unregistered drug in Malaysia? Do we have unregistered drug in Malaysia or not? Do we have it or not? Who said yes? Okay, who said no? Who said I don't know? No worry, angkat je tangan. I je nampak kawan-kawan tak perasan pun. Okay, the answer is actually yes, we do have unregistered drug in Malaysia. But this drug being brought to Malaysia just like, for example, for car they need AP, right? To bring import car to Malaysia, we need AP. But how about our drug? We need special permit. That's why we call this drug is actually a special drug request, or better known as the disease approval drug, KPK. Right? Because this drug doesn't have the MAL number, but we need to bring it in. We mostly use this drug because of the life-saving drug, or maybe because it's actually the drug market is not that wide in Malaysia, so there's no company willing to register it in Malaysia. So that's why we need to bring it by permit import. And this permit import is specifically for that particular patient and institution and only lasts for a year. And you need to keep on renewal it. You need to renew it for this drug. Okay, so you already have an idea what is registered drug in Malaysia, who actually registered them, and can we bring unregistered drug in Malaysia or not, and then where to find this information. We know MIMS contain all drug registered in Malaysia, while Bluebook, all drug that is allowed to be used under MOH facilities. But now, again, I have a question. Let's say this is a new drug being registered under FDA. Can we straight away use it in Malaysia? The drug has been used under the FDA. Can we straight away use it in Malaysia? Is it allowed or not? Yes or no? Who said yes? The drug is already allowed to be used under FDA. Can we straight away use it in Malaysia? Who said no? Who said I'm not sure? All right, the answer is actually they have to register under Malaysia first. All right, now we have to bear one thing in mind. Let's say under FDA, they allowed for 5 indications. When the drug enter Malaysia, perhaps maybe the company will register for 3 indications. So another 2 will be off-label indication in Malaysia. Whoever indication that are listed in your lexicon or in your micromedex might not be the same as in one in the Bluebook or MIMS. We have to have a look. Because perhaps when they actually, the chronology is like this. The FDA approved for 6 indications. But maybe when a company wants to register in Malaysia, they only register for 4. And then when they want it to enter the Bluebook, they only register for 3. So sometimes you can see that it's off-label and MOH, but it's not off-label and the MIMS. So we have to understand the differentiations. The big thing will be under PBKD. MIMS will be subset of it, and Bluebook will be subset of this. Okay? All right, I hope it's clear. So basically, you already know that MAL is the only registration number. There's no such thing as KKM, MOH number. And then you can see the suffix at the end of it. X indicated for the control item, T will be traditional item. And notification will be for cosmetic. We're going to have this session another next month, next month on the cosmetic and registration. So worry not about that. All right, now you know that the one that actually legally handling all the registration is under PBKD. Pihak berkuasa kawalan dadah. All right, and where can we find under Quest? Okay, now all of you go to your handphone, go to Google, type Quest and PRA. Quest and PRA. Ini boleh buat tak ni? Nak terus buat. Ke mana? Nak buka website. Okay. Open. Kau tak? Keluar. Okay. All right, come, let's do it together. Alright, semua dapat macam ni tak? Siapa yang dapat angkat tangan? Ada yang tak dapat? You have to try this at least once. Okay. Right, now we're going to talk about pharmaceutical. Search by, we go for the active ingredient. AI, active ingredient. Okay, semua orang kena try buat tau. Don't worry. Kalau you slow ke tak dapat ke, angkat tangan je. If your internet tak boleh dapat ke, raise up your hand. I'll be there. I think Shikin pun tahu I've been doing this for how many years. I memang akan buat hands on. Sebab if tunggu bawa balik rumah, none of us will do it. We know. Kita belajar semua masa kat undergrad je. Daripada kerja tu semua nanti dulu kan. Balik CME nak baca journal takkan baca pun. So we know that. Right now, let's say we put here telmisartan. Okay, you can see all products under telmisartan in Malaysia, registered in Malaysia. Okay, this is the one of the way that you can see whether the drug is registered or not. And then one more thing, have you seen hologram on your drug? Hologram, dekat kotak tu ada hologram. So you should see the decoder, the hologram juga. Right, because in Malaysia, we are not only facing our unregistered drug, kita pun ada counterfeit drug. Because you can see in Chowkit, they are selling this Mikadis by roadside. So the counterfeit drug. So these are the things how you can check whether your patients are using the registered or not registered drug. Okay. Satu kali tekan satu. You can see who is the manufacturer, what are the serial number, dekat mana semua dekat sini. Even the product leaflet pun boleh baca juga kat sini. Okay. You can see from here. So I know maybe this knowledge is new for some of you. Maybe some of you are well versed, but just bear in mind that maybe that we need to refresh our knowledge. So basically we are learning from each other. So you boleh cari nanti all the latest drug. Company datang kat you, propose, you boleh tengok dekat sini. Check dulu. Register ke belum? Ke baru nak ada proses ke? So alright, okay. Alright, now another tips. I know that some of you might already have your own GPs, might be planning to open your own aesthetic clinic. Alright, you'll be showering with all those journals from those companies. But we don't have time to read from page 1 till the end of it. We might only have time to read the summary, or we don't even bother to read at it. But how do you know what is the trick to help you to read through this journal effectively? Do you know what is the most common thing that you should look into it? If you don't have this data, don't waste your time and don't keep this drug in your facility. What is it? In abstract, what do we have? We have introduction, we have method, then we have results and discussion. Finally, we have the conclusion and keywords. All right, what is the most important part that you have to look into it? Can someone share me the idea? Again, I emphasize there's no right or wrong, because this one you have to learn by experiences and also from your own journey of it. But you might have your own skill and technique, so we might need to actually share with each other. So basically, what is the best way to read it? What is the most important thing you need to look at it? All right, have you heard of this term or not? Have you heard of NNT before? Pernah dengar tak? NNT. Pernah dengar tak? All right. Paskan mic kat atas tu. Okay, what do you understand by NNT?
Numbers needed to be treated.
Okay, numbers needed to treat. Thank you, Doctor. So, NNT. This one, what does this mean? Do you have any idea? What does NNT means for? What are they referring to? NNT means that number needed to treat. How many patients that you have to treat in order to get one patient improve or cure? For example, this drug need 100 patients to be treated in order to get one patient cure or improve in their reading. Example, diabetic patient. We know that we measure by the A1C reduction. So let's say this patient, this NNT is actually 100. So we need to treat 100 patients in order to get one patient be treated. Well, maknanya kena ada 100 orang baru satu. So the bigger the NNT, meaning that you need to let a larger proportion in order to get one patient cured. So if this is actually a most expensive drug, for example, biologics, rituximab, golimumab, cost you around 4,000 per vial. Do you need a high NNT or a lower NNT? Lower or higher? For sure it's a lower NNT, right? Because you need to spend more on that. So this one of the trick when you actually trying to put new drug in your facility. So you have to see, ask them, what is the NNT I want to see? Okay, now that's the first trick. Second one, you know that people will put all their SPSS results in there. P less than 0, 0.5. Significant, significant, significant. I think tak pernah ada lagi drug baru masuk tak significant, betul tak? Every time ada CME baru, drug baru masuk, for sure they'll put the P less than 0.05. But you have to remember this. That is only statistically significant. But what you need to see as a medical officer and specialist, clinically significant. Why do I say so? For example, this drug can cure or can treat A1C and is statistically significant. But whether it's actually clinically significant or not, we have to see. Because we know any reduction of A1C less than 1% doesn't mean anything. Meaning that if let's say this drug can reduce your A1C up to 0.02%, do you want to put there? No, right? We need at least 1% reduction. For example, sama juga dengan BP pressure juga. So that's why we have to see whether it's clinically significant or not. We have to find that data. Because in whatever in the numbers can actually being manipulated. They are not tricking us, but they are manipulating the data that they have. So we have to ask them the clinically significant. How many percent of reduction in terms of that? Not basically after they being actually aggregated in the system. Okay, there were 2 points. So let's recap. You have known the differences between medicines and cosmetic, meaning you know that NOT and MAL, you know one is printed on box, one is not compulsory. Second, you have known how to search for registration product in the NPRA quest. Third, you have learned that PBKD is the one who actually regulatory body in Malaysia handling the registration of product. And number 4, you have learned that MIMS contain all drugs registered in Malaysia. My Bluebook contains the drug actually approved to be used in Malaysia. And we have our registered product under the special drug request. So with that, you already have a good basis of this. That's why you have to have a hands-on so that you have a rough idea how you can actually use for that. Okay. Okay, now let's recap your knowledge during your undergrad. I think you have learned pharmacology during your first year, second semester, or second year, first semester. Okay, what we're going to actually see here about pharmacology, immunology, the thing that you have learned during your undergrad time. All right, let's recap. What is pharmacology? Pharmacology is a study of the mechanism of action, uses, side effect, and fate of the drug in the body. And we have known about ADME. I think you all remember about ADME during your uni time. ADME meaning that it must be absorbed from site of administration into bloodstream. A stands for absorption. D stands for ADME. A absorption, D stands for distribution, M stands for metabolism, E stands for elimination. Okay. All right, there are many factors influencing drug absorption, dosage, formulation. Okay, I have a question. For example, metformin 500 milligram tablet. Then we have metformin 500 milligram extended release tablet. Are they the same? Are they having the same mole number or not? Are they the same form or not? Extended release and tablet. Are they the same or not? Let's say you have 500 already in the Bluebook. When we have the 500 milligram in extended release, do we need to register it again or not? Who said yes? Who said no? Who said I don't know? Okay, the answer is actually there are two different formulations. So that's why you need to know the formulation of your drug, because different dosage will bring different particular of the description. All right. And then we have the route of administration with the IV, IM, SC, and then the age, pregnancy, and disease stress. Right, now let's look at distribution. The drugs are distributed via the circulation to plasma and tissue binding sites, and then to the site of action and the organ of excretion. And there are many factors influencing our distribution. For example, blood flow, plasma protein, tissue binding, solubility. That's why we have to know the polarity of our drug, whether the chain or the salt of the drug, whether it's actually water soluble or not, and then plasma protein, we have to know. And then for a drug to enter an organ, it must permeate all membrane that separate the organ from site of administration. Right, let's talk about metabolism. The body attempts to rid itself of foreign substances, such as drug, toxin, regardless of whether these substances are therapeutic or harmful. So most drugs will be metabolized before they are lost from the body. And then the term metabolism itself, it refers to the making the drug more polar, then it can be soluble in the water. And then we know that metabolism is a process to break down of drug by enzyme and chemical formation. I think we have learned about CYP4A4, 4A34 during our biochemistry time, okay? Right, now let's look at the elimination. Movement of a drug or its metabolite from the tissue back to the circulation and then to the organ of elimination. And then for renal elimination of drug, it involves filtration and secretion. Right, filtration occurs at glomerulus of the kidney, while secretion occurs along the renal tubules. Right, now we're going to move on the ADR. I think ADR is the most prominent thing nowadays because of the vaccination. Everyone we're talking about ADR, AEFI. All right, now before we move further, okay, thank you. Okay, now okay, these three terms you need to actually master it, especially in terms of the aesthetic as well, because most of the aesthetic are new. All right, now we have ADR, we have SE stands for side effect, and we have allergy, drug allergy. My first question, are ADR and side effects the same? Raise up your hand. Who said yes? Are ADR and side effect are the same? Raise up your hand. Yang online ada jawab tak? Siapa cakap ya? Tak. Tak ada orang lagi. Right, for those who actually online, are adverse drug reaction the same as side effects? Who said yes? So who said no? Who said I don't know? Okay. Right, now how about drug allergy? Are drug allergy and ADR are the same? Who said yes? Drug allergy and ADR. All right, who said no, they're not the same? Who said I don't know? Okay, now tell me, what are the differences of ADR and side effects? Since some of you, most of you said, majority of you said that they are not the same. What are the differences? Can we have the mic around? Never mind, just throw out your ideas. Our immunology, I think we learned it during our second year of first semester. Masa you punya undergrad, 5 years of. Anyone? You said the answer? What is ADR? Can someone tell me what is ADR and what is side effect and what are the differences? Tak nak pakai mic, nak cakap je. Tak dengar nanti. Bolehlah pakai mic share, boleh? Jangan risau. No, boleh kan cakap pakai mic, pakai mask, tak ada orang kenal. Unless your best friend, dia kenal lah you.
Any response to drug.
Okay.
Side effect should be any other
Body reaction. Okay, so body reaction dengan side dengan effect tadi, what the difference? Okay. Right. Okay, Shikin. Thank you. Shikin.
From Dr. Farah, allergy by
Pass kat mic,
immune
pass kat-
response.
Shikin.
From Dr. Farah, allergy by immune response, SE known effect of drug.
Okay.
Okay, from Dr. Rishamprit, ADR is occur when a medication is administered correctly.
Okay.
From Dr. Robin, ADR is unknown reaction, SE is known reaction.
Sama lah. Okay, thank you for those online. All right. Now, okay, which one is intended? Which one is expected? ADR or side effect? Which one is expected? Siapa cakap side effect expected? Raise up your hand. Siapa cakap ADR side effect and ADR is expected? Okay, good. So meaning that your lecturer in immunology taught us well. So we have this basic. So actually it's true. Side effect is actually expected. Okay, where can we see the list of side effects? Where can we see the list of side effects? Product leaflet, product insert, dekat Micromidex, dekat Lexicon, dekat MIMS. And this when happen when our public reading the side effects. Kan you nampak kan, bagi paracetamol pun dia pergi senaraikan dekat you semua benda tu. Because we know that occurrence of side effect is very rare or very uncommon. Kita kan ada uncommon rate, dia kan cakap common, 1 in how many per 100, 1 in how many. This is what really happening. We have to face off these people trying everything to the product insert and also Google. So that's why you have to master this. You have to explain to your patients. Alright, now we talk about ADR. ADR is actually what? Unintended, unexpected. We don't even know when it's going to happen. So I have one question. Is your side effect subset of your ADR or not? Is your side effect a subset of your ADR or not? Is it true or not? Betul tak? Okay, katakan yang besar punya tu ADR. Besar punya bubble ni ada ADR. Inside there, the small bubble of the side effect. Is it true or not? So it's true. Side effect is a part of the ADR. Okay, side effect is a subset of the ADR. Now we talk about drug allergy. Drug allergy, is it intended, expected or not? Unexpected. So it's actually a subset of the ADR. That's why when you have a drug allergy cases in your facility, you have to actually plug it together with the ADR form. When you have a drug allergy case in your facility, you got to plug it together with the ADR form. Right now, I'm assuming everyone has been coming from MOH facilities before. Maybe you have resigned or not, or maybe you are still there. What is the color of ADR form in our facility? What is the color of ADR form in our facility? Okay, ada orang jawab yellow lagi. Never mind. You can throw me all colors that you have in mind, or you have seen it at the drawer of the form in your hospital. But at least we get the correct answer at the end of the day. What is the color of ADR form, or what is the color ADR form should be? Kadang-kadang hospital tak ada color kertas dah, ada kata putih je. Semua orang color putih. So what is the color of ADR form? Letak online.
From Dr. Eaton, color pink. From
Okay.
Dr. Rishamprit, yellow.
Alright, yellow and pink. Okay, anyone else? Do you have any other color than yellow and pink? Alright, the original color or the ADR form should be in blue. Right? Blue. Tapi selalunya memanglah facility kadang-kadang tak ada kertas berwarna, diorang akan foto atas kata putih je. But can you report it online on ADR? Let's say you're from your GPs. Can you report it online, ADR? Can or not? Can ke tak? Boleh. Dekat dalam MPRE website ada untuk ADR punya reporting from professionals. Right, now come back to another second question. What is the color of drug allergy card for our patients? What is the color of the drug allergy card for our patients? Recall balik, nampak tak? Pernah nampak patient tunjuk tak? Color apa? Yellow? Yellow, okay, kalau cakap yellow, view pun anggut yellow. Yellow, okay, lagi apa? Color apa dia? Yes?
Red, yellow, white.
Alright, red, yellow, white. They have 3 colors. Diorang cakap lagi. What are the colors of the tulisan dia? The letters will be in? The letters will be in? Red. The card color? Yellow. Okay, so at least memang you all memang pernah kerja kat KKM lah. So the color is actually red, yellow and white lah. And the card is actually being identified based on the serial number. Number pertama akan indicate state mana, kod kedua akan indicate facility mana. The only running number. So we have the databases, okay? Right, so you have to know this. So at least you know ADR form, you know that side effects are part of the ADR, you know drug allergy is subset of the ADR, then you know that we have drug allergy card. Kalau dekat UMMC, diorang dah bagi chain tau. But the one patient has to pay for it. And then drug allergy card ni pun depends pada facility. Some facility diorang akan limitkan. Saya mesti akan bagi macam tu je. Lepas tu nanti lepas beberapa bulan dah habis lah. So depends lah, maybe you will advise your patients. Right? Kenapa I emphasizekan drug allergy card ni? I think past 4 years, I think you all pernah tengok kan, ada patient dia allergic kepada penicillin. And then they have sued the government. By that time, you have to remember that even though they're asking the patient drug allergy history is not really that common in our setting, but you have to make it there. If you put it NKDA, then you are safe. But if you don't put anything, meaning that you don't ask them. Because some of the patient might be allergic to the first generation of penicillin only, but not to the second one. And some of our patient might be allergic to the generic type of our drug because of the color, maybe because of the binder that use, that differences between the innovator. So they have to know about this. Later on, we're going to talk about innovator and generic. What are the differences? Okay. So far, okay? Boleh semua? So far, so good? Boleh kan? Tak tidur lagi kan? Alright. Alright, now this is what definition. Why I don't just read this? Because I don't want you guys to actually, I don't think we can remember this at first sight. We have to actually make it to our own practice and only can remember it. Okay. Alright, adverse drug reaction is actually any response to a drug which is nauseous and unintended and which occurs sama ada dekat dos yang prophylaxis ke, diagnosis or therapy, it can happen. Even though you're giving them at the correct dose also, it can happen. Okay. Right, there are many classification of ADR. We know that whether this one is actually dose dependent or not, or because of the severe disease, that's why you have to fill up the form. All right, type A, augmented reaction. Reaction which can be predicted from the known pharmacology of the drug, meaning that dose dependent. Once you reduce the dose, they can actually cure. For example, bleeding with anticoagulant. That's why for those who are taking the blood thinning agent like warfarin, before they go any procedure, you're going to advise them to stop for a while, right? So they can proceed with the procedure. Headache with nitrate, postural hypotension with prazosin. Type B, bizarre reactions. Cannot be predicted from the pharmacology of the drug, and they are not dose dependent. Actually, they are host dependent. Right, type C, chemical reaction, biological characteristic. For example, for those who commit suicide, dia orang makan Panadol banyak-banyak. So therefore, kita nanti kena buat clearance. Okay, since we talk about the ADR, there are two types of ADR that we don't want to see to our patient because it can lead to fatal. What are they? Can you name me? Two types of ADR. Yang you memang tak nak jadi kat patient you. Apa dia? Can you name me two types of ADR? Start with the letter S. ADR starts with S. What is it? Have you heard before SJS? Steven Johnson syndrome. You tak nak orang nampak benda ni because it can lead to fatal. It could happen in between few seconds to few months and can lead to fatal. Second will be RMS. Pernah dengar tak? Red Man syndrome. So there are two types. SJS dengan RMS is the last type of ADR you want to see in our patient. Okay? Alright, we have type D, delayed reaction. Yang ini selalunya tak akan jadi terawal lah by accumulation. Okay, kadang-kadang patient dah makan for few months, how many years baru you nampak ADR dia naik. And then type E will be end of treatment lah, selalunya dekat prednisolone. That's why prednisolone dia ada tapering dose. Kita akan reducekan, kita akan taperkan sikit-sikit. Right? Alright, and then serious adverse event, an event or reaction that may result in the following outcome. Result in death, life-threatening, require hospitalization, and then disability and congenital anomaly. So from now on, you have learned about registration, you know about the pharmacology of the drug, then you know how the drug reacts to our body, how it's being eliminated, and how we need to tackle the ADR side effect and drug allergy. You have known the differences between these three. Okay, so now let's have our toilet break around 5 to 10 minutes break, then we'll come back for another session of the pharmacology. Okay, thank you. See you after this. Boleh.
Ada apa? Tisu.
Sorry. Okay, Assalamualaikum, welcome back. Right, good afternoon semua orang. Right now, let's move on. Right, this is how the ADR reporting being managed in Malaysia. As we know that all those RPR will be actually reported to the MedRec. And actually MedRec is a committee of the ADR advisory. Actually we have all the specialists, consultant, pharmacists in the board for this. And in Malaysia, we need to send out our ADR to WHO. And usually after a year, all the compilation, WHO will give us the results, whether they actually put it into the list or not, the ADR that we report. So meaning that the quality of the ADR report is really important in order for it to be documented, especially for the Malaysian population. Right, what should be reported? We need to report all the new drugs, meaning that report all suspected reaction, including the minor one. That's why we emphasize for all the med graduate to actually master about this, because that we know aesthetic medicines is not really being used by commonly, especially formulation. So we might not know maybe some of the drug may have different reaction for those who actually from the other country. And then for established or well-known drug, all serious, unexpected, unusual ADRs. And then when there's happening change in frequency of a given reaction, let's say you change from BD to TDS, from EOD to once weekly, and you can see the changes, so you can report. And then ADR to generic is not seen in innovator product. Usually innovator patients are okay, nothing you can see from there. But once you switch the brand, you switch the other, and you can see that they actually start reacting differently. And then ADR to traditional medicines. All right, now I have a question. Can we report the drug that is not registered in Malaysia? Can we send ADR report for drug that actually not registered or patient buying it online? Can we report or not? Under ADR. Let's say patient consume this drug, they are experiencing ADR, but drug is not registered, we don't even know what are the content of it. Can we register? Can we report it or not? Yes or no? Who said yes? Who said no? Right, the answer is actually no. We can only report ADR for registered medicines. Then only you can do all the investigation. You can compare with the holding samples and so on. But if they're not registered, you can report ADR. Right. All suspected drug food supplement interaction. Statement highlighting marine source of supplement such as glucosamine, so can be avoided by those with allergy to seafood. ADR associated with the drug withdrawal. When you withdraw the drug from the patient, you can see that they're going to have the ADR. ADR given due to medication errors, meaning that vincristine given IT, and then ADR due lack to efficacy or suspected pharmaceutical. Right, now let's talk about innovator product. Innovator product, or better known as the original drug. So kita akan cakap ni adalah ubat yang pertama dipatentkan. So we call it innovator. And then for those who actually after 20 years, we call it generic drug. Why we need to report the innovator drug? Because there is limited information when the drug is first marketed. Same goes to aesthetic lah. Mula masuk Malaysia, first time we nak introduce dekat Asian population, and then minimal information used in Asian population. For your information, all those side effects listed in your drug info like CCOM, Micromidac, actually mostly experienced in the US, UK, Europe punya ni, bukan Asian population. So it's very rare for us to know. That's why we need to enhance our reporting to make sure that we are not actually under-reporting. Okay. All right. Now I have a question. How can we check whether this type of side effect is really happening to our patients or not? They say it's very rare. We don't know where to look for it. And then do you have any idea where you can look for it? You dah cari dah dekat lexicon tak ada, Micromedex tak ada. You tak tahu nak cari kat mana. Alright. Right, now all of you take your phone, go to Google, put this in your Google search tu. Cuba tengok apa yang pop up. Saya bacakan Perindopril plus sign nightmare plus help me. Those online also please give a try. Perindopril plus nightmare plus help me. Shikin, can you help to type dekat ni? Okay, thank you. Okay, keluar tak jawapan? Sorry. Semua nampak tak jawapan ni? Sama? You guys get this answer? Okay, sebelum kita tengok jawapan ni, have you guys heard of patient consuming perindopril dapat nightmare? Pernah dengar tak? Because perindopril is a very common drug. Kita akan start dekat patients kan. But these cases happened a few years before. The consultant doesn't know what to do because the patients keep on experiencing the very bad nightmare. And it actually affects their health. Then they come to us and they say that, I already look, do you think this drug can cause the nightmare or not? So we give it ni, but actually the answer is yes. So if you think that maybe that after you dah try everything, you dah narrow down the search, the patient still experiencing something that is very curious to you, you give it a try. Help me is a very reliable source sebab ni under US FDA. Lexicon pun guna sini. So from here you can see that memanglah tak ramai yang akan kena, tapi it can happen to anyone. So from here you can see the range, age group, gender, and then the concomitant drug, concomitant diseases. Common condition when they're having this. So this is one of the web search we can do to find the answer, especially for the side effects or ADR of the drug. Anything you can find here. Okay, actually it's under US FDA, so on Lexicon, so it's not like a bogus website. You can give a try later on. All right, then we know that conduct intensive monitoring to identify the rare reaction. Just like now lah. Because perindopril, everyone is actually giving that. We give perindopril 4 mg, perindopril 8 mg OD. But then this kind of reaction the patient experience, we can have a look. All right, then provide update to prescribers on new finding, labeling, changes, safety issues. All right, these are the generic product. So we need to monitor their efficacy. Kadang-kadang mungkin patients bukannya dia ni mungkin allergic to just about the excipient of the drug. Because we know for generic they have different color, different binder, the thing that they're using compared to the innovator. Right, monitor adverse effect profile to study differences in ADR pattern compared from the innovator and help improving quality of generic. Right, does the problem arise due to ADR or quality defect? Okay, let's say you have the tablet that is chipping, tablet chip, maksud tu dapat dekat you punya GP. Can you report that? Where can you report that? Can you lodge a product complaint? Let's say tablet tu chip, boleh tak you report? Tablet tu chip, nampak ada one ke dalam tu, wah ada suku je. Dia dah pecah dalam tu, dia ada chip dalam, even dalam dia punya kapsul dengan blister tu, dia memang dah chip dalam tu dah. Can you report it or not? Okay, we can do a product complaint based on two things. Satu, drug efficacy. Kedua, physical appearance. Memang kita boleh lodge report ni, product complaint. So this report will go through to the MPRA and diorang akan rujuk kepada company. Okay. So, kalau ada physical appearance yang berubah, let's say sepatutnya dia adalah colorless tapi jadi cloudy. Katakan the solution jadi cloudy, you can report. Ataupun you dapat dah cair dah tablet tu. So you can report it that too. Okay, and then the clinical efficacy will be, let's say patient dah makan ubat ni for how many years? For 2 years under your observation. Tiba-tiba you bagi kali ni high dia punya reading. So we can actually do a report. Okay, alright. Just now we talk about the ADR categories. Now we talk about casualty categories. Casualty of the ADR. C1 will be certain. We are certain that this drug are causing this ADR. C2 will be probable. This is the most common thing because we cannot really be assured, but it's the most probable that causing their ADR. C3 will be possible. C4 will be unlikely. And C5 will be unperceivable. Selalunya kalau bila dia fall under the C5 category, dia memang tak boleh masuk dalam report lah, tak akan diterima. Alright, what does this mean by C1? C1 will mean plausible time. And they are not related to their underlying condition, concurrent disease. And then positive re-challenge or positive re-challenge. Okay, when we talk about re-challenge actually, let's say you give the drug A to this patient, they experience ADR. After a few time or after a few time frame, you reintroduce it, it's called re-challenge. But we don't practice it here. Selalunya dekat sini, kalau dah habis lah. Kita tak berani lagi nak bagi lagi sekali untuk see the effect. Because we afraid what might happen after that. Okay. And C2 will be reasonable time, unlikely to be related to concurrent disease, other drugs. Right, C3 ni, there's no information on the challenge and then it might be due to the concurrent disease. All these casualties ni kita dapat bila kita isi borang ADR tu akan ada markah. So from there we identify whether which category it falls in. And then C4 will be imparable temporal relationship. And finally C5 tak ada information yang cukup lah, insufficient information. Right, now just a brief information on the cosmetic before we go to the pharmacology of medicines. Alright, as we know, cosmetic product is actually any substance or preparation intended to be placed in contact with various external part of the human body. Let's say our epidermis, hair system, nail, lips, and external genital organ, or with teeth and the mucous membrane of the oral cavity, with a view exclusively or mainly untuk clean, perfume, change appearance, correcting the odors, and protecting them in a good condition. Alright, under the CR and also the GMP. Nanti kita akan cakap pasal GMP punya facilities lah. We will talk more about the GMP facilities later on. Also good storage practice. Alright, who should notify the authority is actually anyone who are actually responsible bringing the cosmetic product in the market. They have to notify prior to manufacture, import, supply by wholesale or sale of the product. Let's say you want to bring something from the Korea or Japan, you need to have the LOA, letter of authorization from the originator. Right, you have to know. Okay, now I have a question. Let's say you have a cosmetic to be put in the registration or to be notified, and your lipstick, you have, let's say for example, one lipstick. Do you think how much does it cost for you to notify in Malaysia? Per substance, berapa? Just make a wild guess, no worries. Ini memang tak ada kawan orang tahu unless you pernah buat. Berapa you rasa? Berapa ringgit you rasa? Berapa? Ya, RM50. Tapi, do you know, okay, do you know the market price tak? Let's say you nak ambil third party untuk tolong you registerkan kosmetik ni, how much it cost you? Do you have any rough idea what is the market price for this third party helping you to notify your cosmetic product? Berapa? Cakap je berapa, tak kisah pun berapa? 1,000. How much? Okay, ni harga sebelum COVID lah, prior to COVID lah, maksudnya 2019 dulu. The price lies between 3,700 to 4,000 per product. That's how much they are charging you because you don't have to think anything. They do everything for you. But at least for Mac graduate, even though that you are capable of hiring them, at least you have to know the basic. You know how much it costs, what are the documentation needs, and how the procedure. So at least in case that they are not doing according to your way, you can have the rule as well. Okay, right. Right, selalunya notification ni valid for 2 years. But you have to renew at least a month before expiry lah. Alright, now we can talk about the aesthetic medicine. Right, as we know, okay, just now kita cakap cosmetic, we talk about medicine as per general. We have seen their reaction in terms of ADR, side effects, and drug allergy. And now we're going to have a look of the aesthetic medicine. And then they have a wide range. Kadang-kadang kita ada just a thin definition between the cosmetic or a drug. Now, what does make it fall under cosmetic? What does make it fall under medicines? Can someone give me a rough idea based on our 1 hour and 15 minutes class just now? What is the differences? What make this one fall under medicine? What make this one fall under cosmetic? Just now I already give you a brief idea about it. If we say about medicine, it must have what? Active ingredient. Do we have that in cosmetic? Do we have active ingredient? Right, second. What are the 5 functions of cosmetic? Tadi yang cakap lah, to correct the body odor only for the outside appearance. So yang itu memang dia automatic akan fall under cosmetic. Alright, how about our essential oil? Is it categorized under medicines or is it categorized under cosmetic? How about our essential oil? Is it falls under medicines or is it fall under cosmetic? Okay, siapa cakap dia under cosmetic? Siapa cakap dia under medicines? Okay, siapa kata that I don't know which category it fall, can be under both. Okay, right. The question is actually, I know that some of us actually promoting it to have like physiological action, boleh improve all these things. Okay, can you make such claim under EO? Yang ini general knowledge lah. Can you make such claim under EO tak? Yang cakap boleh improve psychological, can reduce your stress, depression and so on. Can or not? Can improve cough and cold in kill children? Can or not? Right, the answer is no. That's why EO falls under cosmetic. Okay, so you got to bear in mind. Okay, now sekarang ni orang tu cakap, oh, I make this bath soap dekat rumah. Yang ini gunakan barang-barang organik. So this one, should it be notified under cosmetic or not? Can notify ke tak? Should they notify this under cosmetic or not? Dia kata dia buat home base, all organics, all natural products dia guna. Should it be or not? The answer is yes. It still need to be notified. So you have to know that there's no such thing as no notification. Kena ada. Right? Okay, I want to ask all of you, do we have in the ministry temporary registration number? Temporary registration number for our product is this. We are waiting for the KKM approval. Do such thing exist or not? Based on your experience. You think wujud tak nombor sementara ni? Siapa cakap yes? Who say no? Right, who say I don't know? Dan say no. There's no temporary. Kenapa I emphasize? Sebab dekat Facebook, dekat Twitter, dekat IG, people will keep on saying that, oh, this is our temporary product registration number. But actually, there's not. Either register or tak register. Dia tak ada tengah-tengah. Okay? Right? Alright. Now, let's talk about aesthetic medicine. Alright, now we're going to talk about Adipiline, but we're going to talk about topical Adipiline. Alright, they are being used for the acne vulgaris. However, they are contraindicated for those who are actually having hypersensitivity to Adipiline or any of the component of the product. That's why it's very crucial for us to have the allergy history of our patient. Alright, how does Adipiline work? What are their mechanism of action? It binds to specific retinoic acid nuclear receptors and modulates cellular differentiation, keratinization, and inflammatory processes. That's why when they actually inhibit inflammatory, tak dapat control lah dia punya acne tu. However, the exact mechanism is still unknown. Right, now have a look of the ADME. Okay, my question will be in your exam will be the true or false statement. I'm going to put your 1, 2, 3, 4, and I have the answer of A, B, C, D. A, 1 and 2, B, 2 and 3, and for sure D akan ada all above. Okay, that's how my question will look like for it. Right, excretion is going to be excreted in the feces, and biliary route is the major route of excretion. However, how about the half-life? 7 to 51 hours in 15 acne patients treated once daily with Adipiline. Selalunya dalam 7 to 51 hours is their half-life. Right. However, there has been like a quite controversial question. When can you advise your patient to stop using all acidic medicine if they're trying to get conceived? Because usually people akan ambil all these medicines before they orang start kahwin to make sure they look good. And then after that, how long should they wait before they're getting to get conceived? Can you guys share with me your advice dekat you punya facility, your seniors, your consultant, your derm, cakap macam mana? What are the advice? 3 to 6 months. What the rest? 1 year. Yang lain? Yang lain, do you have any idea? How long? How long should they wait before they try to get conceived? Because usually orang akan ambil before they getting married, before their reception. After that, mesti dia nak start planning for their family, dia orang kena stop lah. Right, my advice would be, selalunya kita akan cakap at least for 6 months lah. 6 months macam 6 months tu macam dah, you dah sure lah everything dah clear. Actually memang taklah selama half-life dia 51 je. Mungkin kita ambil 2 to 3, 4 of half-life. Tapi to be on the safe side, selalunya orang akan advise dalam 4 to 6 months. So you take the 6 months lah. Okay. I think the practice is very according to the places lah. Tapi most of the time, most of my colleagues pun semua akan cakap usually around like 4 to 6 months or 3 to 6 months. That will be the most ultimate lah untuk kita advise. Okay. I think 1 year will be too long. I think 6 months tu memang tengah-tengah lah, the most sufficient time for them to actually before they're trying to get conceived. Right. However, for adverse reaction, dermatology, you can see that the dry skin, you can see around 36% will actually experience erythema and scaly skin. However, you have to remember that they have interaction with MTX, methotrexate. So even though they're coming to you to treat their acne, please have a brief background information on what other drug they are taking, what history of drug they have consumed before, and what type of supplement they are taking. Now we know that our nation is actually everyone is trying to consume supplements. So we have to know what type of supplement. Nanti kita tengok ada St. John Woods ke dalam tu ke, ada ginkgo ke. Because some of these interact with our drug. So we have to know what type of supplement they are using. Alright, increased hepatotoxicity, severity will moderate, delayed onset. And then patients should be closely monitored for clinical symptom of liver toxicity. And what are the probable mechanism will be additive hepatotoxic effect and decreased metabolism clearance. Right, for interaction, absorption of Adipiline through human skin is very low, and therefore interaction with systemic indication is unlikely to happen. However, topical gel has potential for local irritation. That's why selalunya kalau kita bagi cream dekat patient, kita akan advise dia guna dia punya pencuci muka sendiri. Because you make them lagi rasa lagi sakit lah. So you advise them untuk gunakan air ataupun normal saline lah untuk diorang pencuci muka. Okay. And then the recommended dose for the Adipiline will be 0.1% cream, lotion or gel and 0.3% gel. How to administer it? They have to apply to affected areas OD after washing, use the cream in the evening before retiring. However, a thin film should be applied. Selalunya sama juga, I will emphasize all of you to have a look how your patient apply the cream. Kadang-kadang you dah bagi dah lama, tapi cream tu tak efektif pun lagi. You have to see how they apply. Sebab orang kat Malaysia ni selalunya lah, basically based on our experience, kalau dekat counter pun dekat ni, like eye drop, it can last for what? For 3 months. Kita bagi diorang. Tapi dia kata cukup, sebulan dah habis semua. Baru kalau tak masuk dah, dia akan keep on putting it. So dia akan makan instead of a drop, perhaps 2 or 3 drop. Sama juga dengan cream. Cream patient kita, tak selagi putih tu tak tebal, tak cukup kan? Diorang tak akan betul tak saya cakap. So let's say in your, of course, if you are in the government city, you don't have time to do that. But if you're in aesthetic clinic, if you really want to monitor your patient, perhaps we could see, show me how you actually apply your cream. Okay, previously kita pernah ada patient, dia punya COPD tak improve pun. Dia kata dia dah apply dah. Rupanya, instead of like putting the capsule inside the handy holder and crush it, they are eating the capsule. So there are so many ways of they doing it. I think kalau you all tengok dulu zaman cerita doktor apa tu? Yang dia tanya patient macam mana dia guna MDI, rupanya dia spray je macam perfume. I don't remember nama doktor tu. I think last time kot during masa our unit time kot, like how many years back. So basically this how we do it. So you have to see how they apply it. You can tengoklah kamu orang buat. Macam mana orang apply the thing there. Okay. Kalau you all tahu that this kind of treatment, especially untuk yang face, skin, ini semua ni is actually individualized. How long should you say that okay now that's it, you should stop, you should change to the other drug? How long you think is the indicator? Berapa lama nak tunggu? Berapa lama? Berapa bulan? Sampai satu tube habis ke? 3 months ke? 2 months ke before we start changing to a new treatment? What is the indicator? Berapa lama? Ataupun cuba sampai boleh. Kalau setahun pun pakai je lagi. Boleh ke buat macam tu? Yes, actually 3 to 4 months. Selalunya kita akan cakap dalam 12 weeks lah. 12 weeks, if there's no sign of improvement, you have to change the treatment. Okay, 12 weeks lah selalunya kita guna indicator dia. Right, improvement of acne vulgaris indicative of efficacy. Right, if the medication is applied excessively, no more rapid or better result. Tapi you akan nampak redness, peeling or discomfort. And this is how we indicate our patient dah terguna lebih lah. Kita nampak tangan dia dah merah-merah, dah kenapa, then we know that clearly dia letak krim sangat banyak lah. We know about that. Right, and not to be taken orally. Kalau oral ni selalunya memanglah patient takkan ambil, tapi pernah jadi kids yang akan ambil lah. Kids diorang yang ambil. So mesti kena beritahu kat diorang lah. Sebab nanti kena buat gastric emptying pula untuk budak-budak tu. So it wouldn't be very good lah. Alright, however, there are few precautions that we have to bear in mind. Concurrent use of other potentially irritating topical product, increased risk of skin toxicity. And then kalau ada cut, abrasion, ada eczema, sunburn, jangan letakkan dekat situ. Maknanya don't apply to that affected area. And then sensitivity to sun. That's why kita buka waktu malam lah. Betul kita kata tadi, kita guna waktu malam. And then sun exposure, high level including sun lamp, greater risk of skin toxicity. And then kalau boleh cakap dengan diorang, masa tengah buat ni, tak payah buat waxing lah. Tak payah buat waxing lah kena mata tu. Kadang-kadang diorang akan buat dekat atas kan, yang untuk ni kan, so upper lips tak payah buat lah pada mata tu. Alright, there are few counselling points that you can use. You have to tell your patient drug causes sensitivity. Kalau patient memang jenis kerja dekat site ke, pergi dekat pergi offshore ke, so you have to remember them lah. And then instruct patient that cold temperatures or wind may also increase skin irritation. Mereka akan lagi sakit lah, jadi pedih. Right? And then this drug may cause a burning sensation, drug sekali or the skin. Advise patient, tak adalah seminggu 2 akan nampak, tapi at least for 2 months akan nampak improvement lah. Cakap dengan patient. And then to avoid concurrent use topical product which may dry or irritate the skin. Right, that's for our topical. Now let's talk about the hydroquinone. And then they are indicated for discoloration of skin and hyperpigmentation of skin. Alright, this one for hydroquinone, kita akan apply dia, kalau emulsion dia, topically BD for no longer than 2 months. Tapi kalau hyperpigmentation, kita akan guna without sunscreen, BD for no longer than 2 months, kena rub in well. Tapi kalau yang with sunblock, tak perlu pun rub in well. Sajalah differences dia. Tapi actually this product varies from time to time. As you can see, there are more products coming in. So you can see all those information on their leaflet. And now, let's talk about how those hydroquinone works. Actually, it inhibits the enzymatic oxidation of tyrosine to 3,4-hydroxyphenyl-N-dopa. And they will suppress the metabolic processes of melanocyte, thus producing depigmentation of the skin, which is actually reversible. However, again, they are hypersensitivity to hydroquinone or any component. Alright, now let's talk about pregnancy. That's why tadi ada tanya dah, that's why tak boleh guna, they have to stop before that's why tak conceive. Tapi, can you use it on the adolescent tak? Umur berapa you rasa baru boleh start all this treatment? By your practice dekat attachment dekat derm semua, umur berapa yang baru suitable untuk start on this drug for this type of experience on the nak gunakan semua ubat ni? Umur berapa? Can we start as early as 13? 14? 15? Selalu kalau dekat derm tu diorang akan ambil patient umur berapa? Umur berapa selalu? 16, 17? Tapi 13, 14 takkan nampak kan? Kita memang takkan ambil kalau as early as 13 or 14 lah. Selalunya 16 and above. Nearly SPM lah baru kita go for the treatment untuk diorang. So because some of them are not really safe for kids lah. Alright, how about the PD and PK of the drug? Onset and duration of depigmentation produced by hydroquinone varies among individuals against. Right, administration, avoid exposure of treated areas to sunlight and avoid contact to eyes. Right, again, for sure they have their own ADR, burning sensation, contact dermatitis, localized erythema. Sometimes you all kena tengok juga, maybe you experience patients you, dia jumpa kita untuk aesthetic sahaja. But let's say they go to other doctors for dia ada dapat banyak kali dapat sakit mata ke, so you have to see lah. Because sometimes it reacts to our drug juga. Kena make sure that we monitor closely dia punya progress yang lain jugalah. Right, again, blue-black darkening of skin can occur readily with emulsion formulation, and if this happen, they have to discontinue. And then limit the sun exposure during and after treatment. Wear sun protective clothing to prevent repigmentation. Sebab kita tengah buat hyperpigmentation kan. Right? Perform a 24-hour skin sensitivity test. And then we have to remember, for those who are having sulfite hypersensitivity, contain sodium metabosulfite. Alright, overdosage you akan nampak. Kalau orang yang guna dekat dermal exposure ni, akan nampak skin irritation lah. But however, untuk ocular pula akan nampak eye irritation, corneal ulceration, mata macam berdarah lah. So you have to remember, if your patient experiencing this, kita kena tanya jugalah, man next visit to us, tanyalah dah apa jadi ke, just to ask them. Tapi jangan bagi tahu lah this possible, you can only ask them. Alright, how the counseling point would be, instruct patient to avoid exposure of the areas to sunlight, and then this drug can cause dermatitis as mentioned just now, and then kalau terkena dekat tempat yang luka semua, rinse it off away lah. Kalau terlupa, let's say kena pakai BD kan, malam dengan pagi, okay, can they actually double up the dose? They don't have to. Kalau dah tertinggal tu, dah dekat dos keduanya, tinggalkan sahaja. Jangan suruh orang double up the dose lah, right? Okay, now we talk about tretinoin, a topical tretinoin. And this actually, yang ni I saja jelas screenshot from the Bluebook. Actually, you can find this from the Quest website, from the memes. And for those who are still in the government, you can go for the memes gateway. Because the government subscribe to all the medical professionals. Memes gateway account, in there you can see all the drug list name, indication, the box, the product leaflet, and paling best sekali kat situ pun boleh buat drug interaction. You put one drug, you pair with the drug, you can see what are the interactions. So you can put all the drug yang patient you ambil, letakkan dengan ubat, tengok match tak, ada apa-apa interaction. And also in this one, where it is very good, you can actually identify the drug if the patient consuming. Sebab dalam means gateway to one of the function, you can put the shape of the drug, color, tone, texture, they can make a guess for you. Can come out and then you will tengok sama tak dengan apa yang patient bagi kat you. So it could help you to guess very well. So memes gateway, MIMSGATEWAY. Kalau yang mana tak ada pun boleh subscribe sendiri. It's not that bukan mahal sangat lah this one. Yang ni paling senang sebab every time dia ada team yang akan check this whole system by weekly. So you don't have to worry because this whole everything, and then they also ada subscribe journal dalam tu. So you can also subscribe journal from there. Okay. Alright, again, our tretinoin is actually indicated for acne, also facial wrinkle. Alright, now let's talk about supplement. Okay, actually, what is the best age for you to start consuming supplement for your facial wrinkle untuk muka semua? Umur berapa? When should we start consuming all those supplements? Adakah umur berapa? Should we start as early as 25? Should we start as early as 30 or what? Okay. Actually, the best way actually not to start too early sebab our body still have their own immune system lagi untuk fight back. Kalau you pakai yang kat luar punya, dia akan berlawan nanti. So it wouldn't be very good. So actually just right before you hit 30 tu dah boleh start lah. But the key problem to all of us will be compliance. Kan, nak makan suplemen hari-hari, compliance tu is very hard kan. And then the most like I think supplement yang quite effective will be glutathione. Glutathione for those who actually consuming at a quite right age kan, you akan nampak letak ada pun wrinkle bawah mata dia, muka dia akan nampak baby face for quite some time lah. So you can consume lah glutathione ni actually quite proven lah, you boleh nampak yang oral. Tapi nak pastikan makan setiap hari tu compliance will be a very big issue for us lah, but it's very good lah untuk make sure, yelah you akan aesthetic nampak muda kan, mesti nak tunjuk muda kan, of course. So you can actually consume that. There are many brands at the market and you can have a try for it. Alright, however, we have the black box warning, but this one for the oral tretinoin lah. We're not talking about the topical. For those who are having APL, they have ADR to tretinoin because they can actually develop rapidly evolving leukocytosis, meaning that can lead to death. However, there's a risk untuk dapat severely deformed infant kalau masa tu di tengah mengandung. And then we have to do the pregnancy testing and contraception counseling if you want to start the tretinoin treatment. Right, how you can apply this tretinoin treatment for this patient for topical? Apply 20 minutes after skin is cleansed and completely dry. Avoid lips and directly under eyes. Avoid UV exposure. And it's available in the form of gel, cream, and solution. Again, Is contraindicated in hypersensitivity and sunburn. Right, what is the dose? We have to begin with a low concentration formulation. Then only baru taper-taper naikkan. And then kalau facial wrinkle, apply a pea-sized amount to the affected area. So you have to show to your patient. Right, how does it work? It inhibits the micrometer formation. So that's why it can decrease the cohesiveness of keratinocytosis in the sebaceous follicle. That's why it can allow for easy removal, anti-inflammatory properties. Alright, you have to remember that absorption is very minimal because it's topical. However, it's excreted in urine and not known when it's excreted in breast milk. That's why for those who are actually breastfeeding and pregnant women are not contraindicated to be given this drug. However, there are a few lists of the adverse reaction you can see. You can have excessive dryness, erythema, scaling, pruritus, hyperpigmentation, photosensitivity, initial acne flare-up, edema, blistering, and then have to be extreme caution eczema, and then concomitant topical medications that abrasive soap, cleanser or cosmetic with strong drying effect akan menyebabkan dia lagi dry lah. And then if you overdosage, you can nampak dia akan jadi chelosis, abdominal pain, dizziness. Alright, again, bear in mind that counseling point, if you miss this dose, don't double up the dose. And then if they want to apply cosmetic, mesti apply after applying 1 hour lah. Let's say nak keluar rumah pukul 7, pakai cuti pukul apa? Pukul 6 lah. Pukul 7 baru boleh pakai kosmetik. Tak sempat. So they have to have an hour lah. Now we talk about Accutane. Okay. Right, there are few available brand of Accutane in Malaysia, and they are also listed in the Bluebook, as I show here. Alright, again, Accutane we use for the nodular acne. Alright, dose dia adalah 0.5 to 1 mg per kg divided BID for 15 to 20 weeks. And dose dia can be up to 2 mg per kg per day. Kalau disease dia very severe lah, nampak kat sini banyak sangat ada, dia boleh bagi. Right, now how does it work? How does Accutane works? You inhibit the subiaceous gland function and keratinization, clinical improvement of nodular acne associated with the sebum secretion reduction. Right, now we have the black box warning again. Tak boleh bagi dekat orang yang pregnant sebab akan dapat severe birth defect. Kalau tak, kena refer kat ONG. Alright, pregnancy may cause embryofetal toxicity, and then for those who are actually allergic to vitamin A, tak boleh bagi ni lah. So you can tanya dekat patient dulu. And then again, very low absorption. However, they are primarily albumin, protein bound. Right, pharmacokinetic be metabolized by the liver oxidation menggunakan hepatic isoenzyme CYP2B6, CYP2C8, and CYP3A4. Return to the metabolite of the 4-oxo-isotretinoin, retinoic acid, and 4-oxo-retinoic acid. Half-life will be 10 to 20 hours. However, yang ini ada banyak sikit list of the adverse reaction. They have the dermatologic, cardiac-cirrhosis, dermatitis, endocrine metabolite. You can nampak kat sini ada profile untuk patient punya cholesterol level juga. So kalau patient is on statin, kena make sure lah, kena tengok dulu. And then gastrointestinal, xerostomia, anemia, hepatic, and then ophthalmic will be dry eyes. Right? Adverse reaction dia cardiovascular. Dia boleh menyebabkan thrombosis of blood vessel. Dermatologic is SJS. Even though it's very rare to happen, kita nak yang one of the patient happen to dekat our patient. So we have to monitor. And then hepatic will be hepatitis, immunologic, anaphylaxis, hypersensitivity reaction. And then we have the musculoskeletal rhabdomyolysis. Neurologic will be cerebrovascular incident, hearing loss, also psychiatric. Psychiatric is very rare, tapi if our patients are under follow-up psychiatric, they may have the chances to have this. So you all can tahu juga. Because nowadays, many orang memang under follow-up psychiatric because of the stress and also our job scope dengan juga COVID-19 pandemic ni yang hit most of us. Right. However, there are special precautions. Anaphylactic reaction have been reported, including serious allergic vasculitis, renal involvement, discontinued therapy. And then kalau guna concomitant use of tetracycline, vitamin A supplement, or Sandron words should be avoided. So you have to know what supplement they are taking. Hearing impairment has been reported, discontinued therapy if tinnitus lah, kalau dia occurs. And then liver enzyme ni jarang berlaku lah, tapi in case patient memang ada masalah hepatic problem, so we have to know. And then visual problem, long-term use or high dose or multiple courses of therapy increase risk of musculoskeletal effect. Okay. Alright, now when we talk about ascorbic acid, kita tahu ascorbic acid ni ada dua jenis kan. Selalunya kau bagi cream dengan tablet. Now I want to ask of you, how about IV ascorbic acid? Do we have it in Malaysia or not? IV ascorbic acid. Ada tak ada? Legally or illegally? Legally, angkat tangan. Illegally? Actually, ascorbic acid injection ada kat Malaysia, tapi we use it for malnutrition. Tu dibenarkan dengan malnutrition, tapi yang kita cakap illegal ni digunakan untuk kecantikan lah. So yang itu memang tak boleh lah. Maknanya IV ascorbic acid memang tak boleh digunakan langsung kalau untuk kecantikan. Because but we have it in Malaysia, we do have it in the Bluebook, we have it in the memes, but only for the purpose of the malnutrition. Because the problem is actually the company also doesn't want to register it under that category in Malaysia. That's why it's not available. Okay. Alright, now I have a question. Let's say you are bringing a product, don't talk about medication yet. You're bringing a product of cosmetic from Korea, Japan, or China to Malaysia. But then they have everything, the product leaflet, product insert, everything in Korean and Japanese. But someone who's already like Korean, K-pop, and so on, you know how to read and translate it. Can you translate it on your own? Can or not? Can you translate all those product insert, product leaflet, everything on your own? Can or not? Okay, who said yes? Who said no? Who said I'm not sure? Okay, the answer is actually no. You kena ambil orang penterjemah yang dah ratified dengan Institut Terjemahan Negara. They are the only one who can actually translate it for you. Okay, so you have to bear in mind that even though no matter how good you are in it, you have to let them translate it for you. Then only it will be authorized. Okay, can you actually, okay, let's say now you are bringing product from overseas. You wanted to give it a try. Ataupun tak payahlah cakap satu tu, nanti dulu kelas nanti. I wanted to give, okay, you pergi for a trip. Dah lama tak pergi overseas kan, pergi trip. Nak bawa balik perfume, for example. Perfume is cosmetic. What is the maximum number of perfume can you bring in? Have you ever thought about it? You pergi, hari tu dapat bawa sindir banyak, bawa balik. What is the maximum number of perfume bottles can you bring in your own luggage? How many bottle? 100, 300, 50? Ataupun jadi personal shopper lah, nak beli sendiri 50 macam tak apa pula kan. You become personal shopper for all your friends because you can go abroad. What is the maximum number you can bring in? Tell me. 10, your friend cakap lagi. Tak apa, ni tak ada betul pun, salah pun, ni tak ada pun effect anything pun. Berapa you rasa? How many do you think? Actually, alright, let's say you nak bawa masuk, you sebenarnya tak boleh bawa masuk lebih daripada your personal consumption for a month. Kalau you nak justify pun mungkin cakap untuk mak ke apa, okey lah. Tapi kalau you bawa lebih macam Chansi kata, oh, I pakai sehari sebotol. So, maknanya 30 botol je lah maksimum. Other than that, mesti akan kena ambil punya. Sebab most of the perfume mungkin tak register kat kita, tak ada notification. So, now you know about that. Sebab kan kadang bila offer you pergi luar negara, you nak bawa masuk face mask. Okay, dulu kalau I bagi contoh face mask, semua orang faham. Now, not this face mask I'm talking about the face mask that we pakai masa malam tu. Okay, kalau nak bawa face mask punya sheet tu, what is the maximum number boleh bawa masuk? 30 lah, atau hari satu. Tapi cakap, I pakai dua pagi dengan malam. So 60, that's it lah. If you bring more than that, memang akan kena rampas. Even though you nak buat sampel ke hari tu, I sharing ni sebab most of your seniors lah, dia orang akan hantar message kat I cakap, I punya standard, I bawa masuk, so katakan 10 kotak, offer dekat Korea, bawa masuk kena tahan. Sebab dia punya maximum 1 month consumption sahaja. So you have to remember about that. Okay? Jangan cakap ni bawa untuk wife I, mak I, auntie I semua, so ya banyak-banyak kotak, tak boleh lah, dia akan bagi. Mungkin untuk your mom or your ni dia akan bagilah, tapi maximum will be 1 month consumption. Paling kuat pun cakap, oh I pakai 3 kali TDS, saya pakai pagi, tengah hari masuk ke office, dengan malam balik rumah. So 90, 100 will be more than enough lah. Okay? Jangan lupa nanti you beli banyak-banyak, bawa balik kena tahan, habis. Perfume pun sama juga Sebab I think, last time ada orang juga, dia belikan kosmetik from Indonesia yang tak ada brand tak dekat Malaysia lah. Kat Indonesia, was very good brand, jadi PS lah, collect semua order. Tiba-tiba kena ambil semua. But it's not notified. So, dia akan bagi a few allowance tu sajalah untuk bawa masuk. Okay? Right, now, let's look at ascorbic acid. So, dah tahu ya, IV ascorbic acid ada kat Malaysia, tapi bukan untuk kecantikan. That's why, Kalau enforcement datang memang kena. Right? Again, ascorbic acid untuk anti-aging. Day application, apply onto face and neck daily before sun exposure. And for the night application, apply onto face and neck nightly after cleansing. How they work? Actually, they inhibit wrinkle formation. That's why nampak muda. Through prevention of matrix melanogenesis and increase the collagen synthesis. That's why I cakap tadi glutathione. Kalau you ambil glutathione, dia akan tinggalkan collagen dalam badan you. But don't take it very young lah. Nanti dia akan berlawan dan dia akan tak cantik. Okay. Hypersensitivity to any component of the preparation. And they have reversible oxidation. And the active metabolite will be dihydroxy ascorbic acid. And then yang ni mild tingling ni very rare. Saya tak pernah nampak lah. So far throughout orang kena macam ni lah. Right, again sama juga special precaution, avoid prolonged exposure to sun, avoid contact with eyes and avoid contact with irritated skin. Complication can cause mild chemical burn in sensitive skin type, but it's very rare again. And then flaky skin for a few days. Cakap dengan patient lah, dia orang mungkin akan eksperimen, tapi jarang lah orang yang kena flaky ni. Jangan cabut lah cakap dia orang, jangan tarik pula nanti luka. Okay. Right, now we talk about xylocaine. Xylocaine ni sama je xylocaine you all pakai untuk you punya GA dengan LA procedure. Tapi untuk estetik ni selalu guna untuk apa? Bila kita buat lip enhancement kan, kita nak cucuk, kita akan combine dengan xylocaine supaya patient kurang sakit. Right, xylocaine injection ni again used for local original aesthetic, and then kita guna dengan hyaluronic acid dermal filler lah. You also akan guna untuk lip enhancement nanti. Dengan 0.3% xylocaine. Alright, sebab yang ini kan guna untuk ni nanti, so you have to use it to add volume and fullness to the skin to correct moderate to severe facial wrinkle and fold. Selalunya lip enhancement ni buat over 21 years old and used to help reduce the discomfort of the injection. That's the purpose of the xylocaine. That's why we have it there. And then for dermal filler will be temporarily restore soft tissue volume, and it vary by composition, duration of action, ease of administration. And then however, injection skill will play a better role in terms of that, patient sakit ke tak lah. Same goes to the vaccine COVID-19 lah. Diorang cucuk tak sakit, diorang kan sangat sakit. Depends on how diorang punya angle cucuk kita tu. Require practice to consistently achieve desirable result. And these are basically the same, the dose yang you all guna dekat common, dekat hospital, dekat you punya ni juga. Epidural dengan anesthesia, concentration 2%, dose with 5 to 10 ml, 100 to 200 milligram. And how does xylocaine help? Actually, xylocaine akan stabilize the neuronal membrane by inhibiting the ionic fluxes, which required initiation and conduction of impulses, affecting local anesthetic action. However, kalau orang allergic dekat amide type of group, dia akan allergic juga dekat xylocaine. Right, since xylocaine is a drug, so the absorption dia can cross the blood-brain and placenta barrier. Is actually metabolized rapidly by the liver, and their metabolite and unchanged drug are excreted by the kidneys. And elimination half-life dia 1.5 to 2 hours. Half-life may be prolonged 2-fold or more kalau orang yang di liver lah, sebab dia memang rapidly liver yang akan metabolize dia. And then renal dysfunction does not affect xylocaine, sebab xylocaine ni hanya untuk yang unchanged saja yang akan liver by kidney. Okay, this one akan ada banyak sangat adverse reaction. Of course, we know in combination with hyaluronic acid, kita akan nampak swelling, redness, tenderness, pain at the injection site. However, in terms of the local original aesthetic, you can see that very common, dapat muntah, rasa mual, hypotension. And then like common will be hypotension, nervous system disorder, vomiting. Uncommon yang ini jaranglah jadi. Tapi kalau orang yang allergic akan nampaklah benda ni. So we have to really take a look about this. However, there are few special precautions for the xylocaine. Injection should always be made slowly with frequent aspiration. I think nanti in terms of diorang punya hands-on, yang buku log tu you all akan ada kot. I think previous students diorang memang akan ada requirement untuk buat this type of service lah. Careful and constant monitoring of cardiovascular and respiratory vital sign and the patient's state of consciousness should be accomplished after each local LA injection. Should be kept in mind that such time restlessness, anxiety, tinnitus semua tu early sign of CNS toxicity, maknanya central nervous system lah. Yang ini kalau yang jarang berlaku, tapi this one I think is a standard procedure checklist kita buat juga masa dekat kita punya practice lah. And then in combination with the hyaluronic acid, differ use at specific site in which an active inflammatory process, maknanya skin eruption such as cyst semua tu of infection is present until the process has been controlled. Tapi kalau patient ada acne dekat mulut dia, boleh buat tak? Kalau patient ada acne kat bibir dia, can we proceed or not the procedure? Kalau ada infection, ada scar, ada luka, tak boleh. Nanti akan lagi teruk. Right, with that, I end my presentation. We're going to see you again in another month. So in that, we're going to focus more on the cosmetic and also the advertisement. Even though you might not actually promoting or actually manufacturing your own cosmetic, but at least you have a rough idea what it's all about. So let's have a recap. You have known what differentiation between the medicines and cosmetic. You know the legal bodies actually identification of the medication. You know about all the databases to find the drug registered in Malaysia or not, the MIMS, the Bluebook, the PBKD. You know about the cosmetic notification. And then you have learned about the side effect, ADR and drug allergy. You know the drug allergy card that should process to your patient if they required one. And then you have learned about cosmetic registration in Malaysia. It will take you 50 ringgit per substance per variant. And finally, you have learned about some of the medication used in aesthetic medicines for innovator and generic and what other steps need to be taken. With that, thank you so much. Assalamualaikum warahmatullahi wabarakatuh. Thank you so much for cooperation and attention. Question soalan
Ada question, yes. Question from Dr. Ethan. Is there a difference between IV and oral glutathione?
Tak dengar. Apa? Is there a difference?
Is there a difference between IV and oral glutathione?
Of course, the effects. Of course, again, as they are the drug, of course, the oral and also the IV will be different in terms of efficacy, in terms of the onset of the action. Okay.
Which is better from Dr. Ethan? Same.
Which is better? Actually, very hardly to see if you, because usually glutathione, if you consume orally pun, within 1 month dah nampak. Usually 1 to 1.5 months, you try makan, mungkin nampak. But if start it very late, let's say dia dekat 40, nampaklah sikit nampak. So this how it's going to see late. Okay. Yes, yeah. Pardon?
ISO 39 can be only paid.
Yeah, for those actually the same rules is still applied, meaning that for all the drug under the specialist, for dermatologist specialization, for sure only them or she can prescribe. So it still work that way. Okay.
Dosage for oral?
Oh, they want to have like you have to check for it because ini for supplement glutathione kan, selalunya orang akan make one OD je. It depends. Actually, it depends on the supplement. You have to see about the product insert. And usually the requirement will be only 1 OD. Because supplement selalunya 1 OD ataupun 2 kali lah, right?
Okay, next from Dr. Rishamprit, is glutathione safe during breastfeeding?
I think it's very secondary product. I have to check back about the brand and also the active ingredient inside there.
The next from Dr. Munis Laxmi, is there skin prick test for anesthetic injection for those who has multiple drug allergies?
Actually, usually for those who are actually allergic, they're doing their own prick test because we don't actually have it. But I think for those who are actually experiencing very severe eczema, so diorang akan buat test ni apa yang diorang allergic lah. But for us, we don't know. We have to ask them. Let's say we already asked them and that thing happened, but they also not know about it. At least we already have the documentation to protect us. Okay.
Okay, next, can IV vitamin C in theory work for better skin?
As I said that I couldn't answer for that because as we know that we actually don't actually give it for the beauty purposes, and I think until now it's not actually legally being doing. I think most of the beautician only the one who doing it. I don't see it in aesthetic if you are doing it legally. Okay.
Okay, next, is there any brand of hyaluronidase that is registered in Malaysia?
That one I kena check balik lah. Hyaluronic acid kan tanya kan. But again, I won't be promoting any brand. I won't be mentioning any brand or any type of it. I can only say as a general in terms of active ingredient or pharmacological because I cannot do any promotion in terms of the brand. Okay.
Okay. Are esthetician allowed to dispense topical tretinoin?
Again, for all the drug listing, let's see, you have to look at the category of the prescriber. As I mentioned just now, it still works the same way. If it's under the derm, for sure it's under the derm. So it doesn't work differently for the aesthetic as well. Okay. All right. With that, thank you so much for your kind attention this evening. Stay safe and all the best. See you guys again next month. Right.